We are pleased to report that the Ministry's efforts to procure directly from international manufacturers and wholesalers are proving fruitful. In the initial phase, phase 1, we engaged with 41 pre-qualified manufacturers and wholesalers, receiving offers for hundreds of essential medicines and clinical supplies. We have evaluated the offers made in phase 1 and anticipate significant cost savings and improved supply security. Now, in relative terms, these offers have potentially generated savings of approximately 221,494,485 Namibian dollars and 81 cents. Please put your hands together for that. Compared to the weighted average intermediary prices, if compared to the maximum benchmark often used in intermediary-led emergency procurement, the savings can be significantly higher. In both cases, though, our efforts have proven that there's better value for money and more stock of the same quality could be procured for the benefit of the public system and public health.
The Health Ministry at present does not have consistent long-term supply agreements in place for many critical items. This situation had led to legal challenges launched by some suppliers 4 years ago, which were eventually settled. However, Minister Luvindao says the Central Procurement Board of Namibia is in the process of finalizing 2-year contracts for general pharmaceuticals
to ensure a steady supply of essential medicines. The Ministry is now actively working in stabilizing the national stock levels, after which we will transition towards a structured supply planning model anchored by long-term contracts pegged to manufacturer prices. So another reason that going to manufacturers in this time helped us is because it offered us a sense of transparency. Now when dealing with, if we're dealing with a contractor, we know that, okay, fine, but yes, we need it urgently. Yes, you have the systems in place to provide it. But based on what we know this costs, this is a 500% markup. It doesn't make sense.
The Health Minister further warned that suppliers who fail to meet their contractual obligations will not be tolerated.
Where it is evident and it is clear that there is no regard for the system, where it is clear and it is evident that there is no regard for the people that are suffering on the opposite end, this becomes problematic. In some instances, the Ministry will be going as far as within these coming few weeks, we will be publishing certain partners, certain entities, certain companies that will be blacklisted going forward and that we will not be working with.
According to Dr. Luvindao, direct engagement with accredited global manufacturers, consolidation of warehousing, and the transition to long-term contracts are a strategic shift to restore public trust.